Good evening, everyone. Thanks for coming back again. Tonight, we want to talk a little bit more about informed consent. I'm having some trouble pulling up a slide that I had that showed an informed consent form. But what we want to do is kind of go again through some of the elements that we talked about last night. My name is Carolyn Curtis. I'm the CEO and founder of the Carup Company. And as with anything, there are always times where there are quirks, and tonight we've got a quirk, but we're going to work around it and we're going to do just fine. Let me just pull up what we talked about last night. And I also want to get into birth plans because you do have options about things that you would like to have at your birth. And that was on my item in the slides, but we're going to still walk through that and deal with it. So give me 1 second and we will pull this up one more time. So last night we talked about, do you know what you're signing? We talked about why it's so important because of the history of what's happened in this country with race and medical practice, that Blacks have been experimented on since the time of slavery, and it still continues. We have where Blacks were experimented on to come up with a surgery for fistula. These women had 30 surgeries without any anesthesia, even though anesthesia was available. We have Henrietta Lack, who in the 1940s had cervical cancer, was treated at Johns Hopkins University, and when they took her cells for biopsy, her cells were realized to be, they lasted forever and ever. They were like immortal cells. And those cells were cells were taken from her body without her knowledge and consent. Those cells were sold to labs all over the world. And she actually received an award for her cells being for modern medicine breakthrough. Her cells were used for COVID-19, the development of a number of vaccines. And you can look at that in my previous slides. We also talked about how when women want to have sterilization done, having their tubes tied, that they now need to sign forms at least 30 days in advance. And that is because over 100,000 Black Latina women were sterilized without their knowledge in the 1960s and 1970s. What I wanted to do was to talk to you a little bit about walk through a form that I found from one of our hospitals. And I'm not even sure if I can find that. I don't have it easily available for me to pull that form up. But anyway, let me see if I can find it quickly. It was from one of the local hospitals, and this was their pre-admission form for women to sign prior to coming into the hospital for labor and delivery. As you know, most hospitals are part of large healthcare systems. In this area, we have MedStar, we've got Johns Hopkins, we have a number of different types of systems. And that form was actually for all clients who were in that particular system. You would write in the date, you would write in the hospital that you're going to have your baby in. But what I found a little bit alarming, and this is something that you need to really read those forms very, very closely. This form was 14 pages. It included financial information, so that you're giving consent for finances and also accepting all responsibility for any finances that may not be covered by insurance or whatever insurance company you have. The things that I found a bit concerning was that you were signing a form not only for yourself, but for your baby. All of this was within this one form, and that you were literally signing over for any type of medical procedure, surgical procedure, diagnostic procedure. All of this was captured in one paragraph. Now, what rings off alarms for me is that if I go in for birth, this is giving them the consent to do vaginal birth, cesarean section anything without any further consent forms. And as we talked yesterday, when you're getting informed consent, there should be some sort of conversation about the proposed intervention. Why do you need this particular intervention? Why do you need to have a cesarean section? Why would you need to have your labor induced? All of these things should be discussed with the patient. And if there's any negotiation around that, then that is done. And there's time, most times for cesarean section, most that I have seen, there is kind of it's a progress. It's a progressive thing, step by step. It's not you walk in the door unless it's an emergency, which can happen. It is, you kind of have some idea that the cesarean section may be coming because the progress is not being made. And so there can be that conversation between you and the provider. But to sign a consent form that kind of has all of this built in, I think is problematic for you as the client who's paying for this care. The other thing is that when you're at teaching hospitals, you also have, it's meant to teach residents, young doctors who are training, those who are training. So you have medical students. If they have affiliations with schools of nursing, which is the case in the Washington, D.C. area, then you have schools of nursing that may send their students there. So you've got medical students, nursing students, you have residents who are doctors, but yet they're beginning to do their actual training in the area that they're working in. And so it's an assumption that all of these people are going to be at your birth. And what was included in that was that you are able to say, I don't want to have medical students. I don't want to have nursing students. You have the right to be able to say that. As I mentioned, this birth is your birth. And it's not the birth for the world unless you don't mind the world being there. And for some people, they don't mind that they have students present. But for others, they mind very much. And you do have the opportunity to say, no, I don't want that. And it gave room for you to write and to inform someone, either the charge nurse, the head nurse, whoever is there, that you do not want these persons available in the room when you're having your baby, or even in labor for that matter. The other thing that was interesting was that you were, in this particular form, allowing the doctor to designate someone else to do his duties. So it was the doctor or his designee. I'm going to give you a little story about my brother who was being seen at one of the teaching hospitals here. He was the patient of the head of neurosurgical department. Okay. That was his attending doctor. We talked about types of doctors in the earlier video. He went in to have vascular surgery done. And this was during the time of COVID when not a lot of people were able to come in. The regulations for that hospital is that there could be one person per day. You could switch people out from one day to the next, but one person per day. And I was designated to be his person because I had the medical background. And do you know, they had a team of nurse practitioners, but my brother wanted to see his attending doctor. That's who you are paying money for. And so it's important that you understand what's in these consent forms, because that consent form that from this local hospital here, it's a teaching hospital, was that your doctor may not possibly even see you. They may designate the residents to take care of you, and you may not even see your attending doctor, and you have consented to that. Well, you can unconsent to that. You can say, no, I don't agree. It is possible times when you do need to have other doctors to cover for each other. But when it's to the point where you're paying for this attending doctor, we ask day after day after day, when is he going to see his doctor that he's paying these tens of thousands of dollars for consultation. Do you know when my brother saw his attending doctor? On the day he was being discharged, and he had been in the hospital for over 5 days. I have a problem with that. You probably would as well. The other thing to look, which is kind of constant throughout many of the consent forms, is the fact that they are able to use your tissue for research, your blood or any kind of tissues that the hospital can dispose of or use for research. And some families want to actually take the placenta home with them. You have to make that be very, very clear, okay? But in that consent form, it's saying that the hospital has the right to dispose of, which is okay. It has the right to do research on. Do you want them to do research on your blood when you get absolutely no? This is Henrietta Lack's situation. She didn't sign a consent form for her cells to be used for research. They were just used without her knowledge. And so that is something to ask for. So these are the things to look for and to know that you can sign against these things. You can, just because you have a nice typed up form does not mean that you cannot X out, draw lines through some of the information that is on that form. If you don't, I've done this. If you don't agree, you just put a line through. No, I don't agree with this. You can write in what you may agree to. So these are the things we're talking about in terms of informed consent. Again, there should be disclosure of pertinent information. The other thing that I found very interesting was the form said that all the risks and benefits had been explained to you. Well, first of all, I don't know that I need surgery. So this form is saying before you've even come to the point of needing cesarean section or whatever type of procedure needed during labor and delivery, the form is saying that you have already had the benefits, the risks and benefits explained. You don't even know if you need it. So I found a lot of difficulty with that. And so that's also another area where you may want to put in there upon consultation with your physician at the time, or, just X that part out, because you have not at that point had any kind of explanation as to why you need a particular procedure, what would be the risks, the benefits, possible outcomes from that procedure. So I found that to be very problematic. There needs to be, so this exchange of questions, if you have questions, these are forms that are online. My recommendation is that you download all the forms, that you go through all of these forms, and way, way, way in advance of your due date, I'm going to suggest around 36 weeks, that you will have reviewed these forms, that you will take back and ask questions and make sure that all of your questions are answered before you sign and send them back in. Again, this is meant to have efficiency, but efficiency can also circumvent your informed consent. What we want to do is to now talk about birth plans, and birth plans come into play with this informed consent. Earlier in our episodes, the question is, what do you want your birth to be like? What do you want it to be like? It's fine to have ideals about what you want your birth to be like, because no matter where you have your baby, some of that can be carried out. I mentioned in many episodes ago that I had worked at a facility in Philadelphia, Pennsylvania, known as Booth Maternity Center. And it's been long closed, but it was an incredible place to work. We had orientation nights because there was a lot of demand to come to our facility. The facility was a level 1 community hospital. We did have the capacity for cesarean section, for epidural, And if you got to be high risk that we could not manage, sometimes, not often, we would need to transfer you to the teaching hospital in the city of Philadelphia. We were on the outskirts of Philadelphia. But what made this institution so unique was that it was thought that you were normal until you proved otherwise. Hospitals generally consider you to be abnormal and that you're going to need a cesarean section. And so that's why all these prohibits against drinking, eating. Okay? The whole getting up and out and walking out of bed, people don't want you to interrupt the external fetal monitoring. Well, there are such things as monitors that you can move about with. So, but I just learned so much there, and this is in 1980. Everyone had a birth plan as to what did they want their birth experience to be like. Some of those things were, I want music when I'm in labor. We hardly at that time ever went to the delivery room. And every now and then we would have a patient request to go to the delivery room, and we would knock ourselves out to make sure we went to the delivery room. We practiced making sure that mom got this baby immediately. We did not remove the baby from the parents. People were up and walking, eating, drinking. Nourishment is very, very important in labor. And so what is the substitute? An IV. You could drink, you can have clear liquids. I mean, it's possible to do this. So these are things that you should ask about in labor, okay? Being able to get up and walk. It is no reason for you to be tied to a bed just because you're in labor. You're not sick. This is a natural, normal process. And so being able to be up and moving is really important. Even if you're getting Pitocin induction, you can sit in a chair. You don't have to be lying in bed. You can still be monitored while you're in a chair. Some people want water births. And so my suggestion is, as we look and make decisions about who you want to be the provider, where do you want to have your baby, that you, as a part of your research, actually tour the hospital facilities if you're going to have your baby in a hospital. Sometimes some of the rooms have tubs, others don't. So the question would be, can you buy your own tub and bring it? That way you can guarantee that you could have a tub for water birth in a hospital setting. If you're at home, you can also have a tub ordered. The other is whether or not they use water therapy for pain management. What do I mean by that? Where you're able to sit in the shower. Is there a bathtub in any of the labor rooms? I don't normally see that, but often there are showers. And with a shower chair, you can actually sit in the shower, and that can be very helpful for pain management. The other things are, do you want to carry your placenta home? If that is the case, then you should let that be known. Do you have concerns about having an IV? You should have discussion in regard to that. What about for dad cutting the cord? That needs to be a part of your birth plan as well. For the baby, there are some shots that the baby gets, things such as vitamin K, that some families agree with or don't agree with. Babies will get ointment to their eyes to protect against gonorrhea. That is something that is negotiable, perhaps, but that would mean that any gonorrhea tests are fine, negative. If you want to immediately breastfeed your baby, that is something to be stated, because hospitals do a really good job of putting a bottle in your baby's mouth when you want to exclusively breastfeed your baby. Some will say, please do not cut the cord until it stops pulsating. Why about that? That's actual blood transfusion that your baby is getting from the placenta. And there is no rush to cut the cord in most circumstances. Most circumstances. And so if there is no need from a medical perspective to cut the cord early, and I can tell you when that early might be, is if the cord is around the neck in a way that it cannot be unwound. Cord around the neck occurs frequently. You cannot stop it. It occurs so frequently, it's the first thing you check when a baby's head is born, okay? And so the question is whether or not you want to wait until the cord stops pulsating before it is cut. You can make that request. The other is whether or not there is the collection of cord blood. That is something that you need to decide about. Cord blood has a lot of great material, like stem cell material. You can have cord blood banked for your family's use later, or cord blood might be drawn or taken where it is then put into a public pool. But that again, it's your cord blood, your family's cord blood, your family stem cells. So you may want to read up about this and think about that. The other is whether or not you want your baby to get bathed with the vernix right away. The vernix is this white coating that's over the baby, and it has many good properties. It is a moisturizer for the skin. It has properties that will protect from infection. It will help, like if there's any little scrapes or anything in the birth process, help with healing. So there's a lot of really good things about the vernix. And some families ask to delay doing a bath for the baby. Also helps to keep the baby warm. And you also don't want to have the baby bathe until the baby is able to stabilize its temperature, because mom's been keeping the baby warm. So these are things that you can consider for your birth plan. My recommendation for you is that you have a birth plan that is established by 36 weeks of your pregnancy. That way, this can be reviewed with your provider. It becomes a part of your chart, and that it is also, you bring a copy with you when you go into the hospital if you're having your baby in the hospital. A lot of these things that we're talking about are just kind of part and parcel when you have your baby in a birth center or have your baby at home. So these are the things in terms of conformed consent and in terms of birth plan. Again, I hope that this information has been very, very helpful to you. Tomorrow, we're going to have a physician on who's going to talk about managing your doctor. Dr. Patrick will be on with us. That should be an interesting conversation, because it will fit in all with the informed consent. The one thing that I want to do on Monday, which is going to be the last day of continuous nightly live events, and then we will change the scheduling on that, is to talk about informed consent around abortion. There's so much going on in the news related to this, and I wanted to ensure that you felt that you were also getting informed consent related to this procedure. This also is a part of pregnancy, and when one becomes pregnant, decisions are made in regard to the pregnancy. So we will have that conversation on Monday. So again, thank you for your time. Please feel free to like my page and to subscribe to my page. As I have said, if you've liked what you've heard, please tell your mama, your daddy, your sister, your brother, your aunts, your uncle, your nieces, your nephews, and your cousins, the girlfriends, the boyfriends. Tell all of them, all right? And look for my ebook that will be coming out. I will be putting information where you can contact me to get more information for that ebook. So once again, thank you so much for your time. Have a great evening. Bye-bye.